Hi, welcome to video number 2 on alternatives for ADHD. I'm going to start this video with a confession. As you can see on this title slide, I'm a little different. Now, some of you may be thinking, well, a lot of psychiatrists are not just a little different, they're very different. And that's not really what I'm talking about here. What I'm talking about here is alternatives for ADHD. I find I'm a little bit different than some of my colleagues, or many of my medical colleagues, when it comes to looking at the role that alternatives play in the treatment plan for ADD and ADHD. Just as a background, in case you didn't see video number 1, my name's Dr. Kenny Handelman. I'm a child, adolescent, and adult psychiatrist. I'm board certified in the USA as well as Canada, and I work just outside of Toronto, Canada. I'm an expert in ADD and ADHD, and my mission is to make sure you have the right information to make the best healthcare decisions that you can about ADD and ADHD. I feel I'm an advocate for you to make sure that you can get the information you need, particularly for this video on alternatives. So we like to get a little brain connection there so that you can have the information you need. And today we're going to talk about how I'm a little bit different when it comes to alternatives. Now, in my medical training, I was trained to look for the science, to look for the research, to follow standard medical care. So we've got a picture of a skull x-ray, some test tubes, the research, as well as an older physician or an expert. And this is how we're trained in medical school. We're trained to look to the research and look to our senior, more experienced colleagues to learn about what the best treatment options are. And that's how I was trained. And really, what's the training for alternatives for ADHD? The training is they don't work, they're a waste of time. The recommendations are to go for multimodal treatment. In other words, medication plus behavioral therapy, counseling, and other strategies. Unfortunately, in many communities, those other treatments are not that readily available. So ADHD treatment often just becomes all about the medication. But I was trained to really, carry the line, and when it comes down to it, there's a medical licensing authority that gives me my medical license, and they want to make sure that I'm meeting the standard of care. In other words, I'm giving the recommendations that the psychiatrists do in my country and my community based on the research that's out there. So that's how I was trained, and that's how all doctors are trained. As I was going through my clinical practice, having been in practice now for just over 10 years and having trained for longer than that, so we're at about 13, 14 years of doing psychiatry at the time of this recording, as I was going through, I started to listen to the families in my office, the mums and dads, the boys and girls, the teens, that were telling me their experiences. As I said in video 1, most people don't tell their doctors about the fact that they use alternative treatments. And that was me. I wasn't finding out because I wasn't open enough and I wasn't asking the questions. Now I do. And I find out that lots of people have tried many things. Part of what happens is they don't necessarily have enough background or research to know the true facts and the best ways of applying the alternative treatments. But because I started listening to the families I was working with, I started to learn more about it. So what did I do? I combined what I learned from my medical training with what I was learning from the families, and I started doing some research. I started scouring the medical literature to look up what is the actual research. I know most of my medical colleagues say that there is no research and these treatments don't work, but I also know that most families are trying these treatments. So I need to get the facts. And that's what I did. I started researching. I looked up, looking for different studies over a number of years to find different research on the different forms of alternative treatments that are available. And I found studies, and there are studies. And this started to inform how I was working with my patients. And it started to inform other people on my websites and with other people who have websites, and we're doing conferences and that. And they'd ask me to start teaching about alternatives because I was making people aware that I read about this. There is research and it's worth discussing and knowing. So people started to be aware that I know about alternatives, and I started to share the research that I found. Though I have to admit, in my office, I still feel like it's a little bit of a secret. Just the other day, or actually just yesterday, I was talking with a family and they were asking me about diet change for ADHD. And I couldn't help but say, the standard medical answer is there's not enough research to say that diet change works for ADHD. Now that I've told you what I'm supposed to tell you, there are a few things we can talk about. And then we broke into a discussion about some diet changes that may make a difference. And we talked about how they could practically work with that, etc. But I still feel almost like in this day and age, in this medical environment, that it almost is a bit of a secret. But now I'm coming out with some videos and hey, I'm letting the cat out of the bag. I do know about alternatives for ADHD and I'm willing to share that information. Now, when it comes to looking at alternatives for ADHD, I really think it's very important to consider the fact that treating ADHD or ADD is like a marathon, not a sprint. What I mean by that is, most people who have ADHD have it for years. We're not talking about a condition that's around for several weeks or a couple of months. It's there for years. Most of the time, people have mild to moderate ADHD. Sometimes people have severe ADHD and they need treatment pretty quickly to deal with some serious consequences. And if that's the case, you may need to start with medicine first and then come to alternative treatments a bit later once you're out of a crisis. But most of the time, people are not coming in a major crisis. And a lot of my medical colleagues and myself in the past, we used to go ahead and recommend medicine right away. And at this point, I like to take a little more time to explain the options and give people the opportunity to look at the treatments they want to look at. Because ADHD is a marathon, not a sprint. If I push people to try medicine before they go ahead and try diet change, if that's what they feel in their heart they need to try, then I feel like I'm doing them a disservice and they will be less trusting, less cooperative, and they may not work with me over the number of months and years that they need to protect against long-term consequences of ADHD. So it's important to think about ADHD in the long-term perspective. It's a marathon, not a sprint. And also think about the mild, moderate versus severe. If there are serious consequences, generally speaking, the alternatives take longer and may not have as strong of a treatment effect, particularly not in the short term compared to the medicines. So you need to think about the balance. Even though I'm for alternatives and those treatments, I'm also for medications. I'm really for a comprehensive, inclusive treatment plan that works on all aspects of ADHD. So that concludes video number 2. If you want to learn more, you can go to alternativesforadhd.com. Thanks for watching. This is Dr. Kenny Handelman. Bye-bye.